Hey everybody, this is Dr. Mike Okuchi from Velocity Wellness Center. I want to welcome you guys to our webcast tonight. And tonight we're going to be talking about a very touchy subject. And I know it's a subject that has touched each one of our lives on a personal level. And we're talking about the issue of cancer. And is there an answer for this? So I'm going to try and present some things to you to kind of give you an overview of maybe some things that are not necessarily divulged or not necessarily even known by a lot of people, especially the person who is not in the medical field itself. So I wanted to give you guys an overview of that tonight and kind of show you guys maybe another different option, maybe another different outlook to what's going on, and give you guys an overview of what we do in our office to help patients back to health. Okay, so a little bit of a disclaimer though beforehand is that the information that we're presenting here is not intended to, treat, cure, diagnose any type of specific disease. It's truly just for informational purposes only, and the information that we're going to go over here is not a comprehensive thing. It's just a brief overview of this vast topic. And like I said, we don't know a lot about this. We don't know the full compendium of what's going on here. And before partaking in any type of health regimen, I want you guys to consult with a qualified healthcare professional and see if, doing a program that will get your health back is something for you. All right, with that said, let's move on. So the question is, are we really winning the war against cancer? We see, in the 1970s when Nixon first said, hey, we're having the war against cancer, and then, we has this onslaught of treatment regimens, and we went out and tried to wage this war against cancer. And, the American Cancer Association put out this statement that we're winning the war against cancer. And this little statistic was then released. And I saw it, and you look at the bottom of mortality, right, with those three bottom lines. It says male mortality, male and female mortality, and female mortality. And you see that line, the trend is going down. Yeah, we're doing a great job. We're allowing people to live longer. But what really caught my attention was the top three lines. If you look at the top three lines, that is the incidence or the rate of occurrence. And that has been at an upward trend. So that doesn't necessarily mean we're winning the war against cancer. It means that cancer is still rising at a rate, but we're keeping people alive longer. But then the question becomes, what is their quality of life? Just because we're increasing a person's lifespan, are we actually increasing their health span? And that's the question that we ultimately have to answer. Okay, so ultimately, we have to ask the question, well, what's causing the body to develop cancer? Is it just DNA damage? We've been told that it's all in the DNA, it's all in the genes. I have cancer that runs in my family. Is it just that? Well, they did this study, and this is pretty phenomenal, where they actually took out the nucleus of a cancer cell and put it into a healthy cell just to see, hey, you know what? If it is in the genes, then if I take the nucleus out of the cancerous cell and put it into the nucleus of a healthy cell, that should make the healthy cell become cancerous. So here's what they did, right? They just basically swapped out the nucleus. But what they found was that the normal cell, even with the cancerous nucleus, which had the damaged DNA, still remained normal, and the cancer cell that got the brand new healthy DNA remained cancerous. So that made people scratch their heads. Well, is it really just the DNA, right? Is it really just the DNA that's causing, is it just the DNA damage that's the causative factor for a normal cell turning cancerous? And if you see in this experiment, the normal cells remain normal and the cancer cells remain abnormal. And if we even look at, if you go onto the American Cancer Association website, they list that the majority of all cancers is related to lifestyle. It's related to, consuming tobacco, alcohol, being overweight, having an imbalanced diet, hormonal imbalances, lack of physical activity, chronic infection, environmental toxins, radiation, and that last 5% is what? It's genetics. So we're looking at the DNA and we're blaming the DNA, yet it accounts for only about 5% of all cancers. So if you look at the causative factors, these are the 6 causative factors that we address in our office: decreased oxygen, chemical toxins, high dose ionizing radiation, nutrient depletion, chronic infections, and structural imbalances. And that's what we're going to go over in this presentation. So what I want to get into your mind is that the causative factor for cancerous cells, the majority of them, I'm not saying all of them, the majority of them, we find that it's the mitochondria, that little organelle within the cells that produces energy. It's the mitochondria that's not functioning properly. Okay, so let's take a look further, and this is why I say that cancer is actually not a disease but an adaptation. And what's happening here is that it's adapting to the environment. So here we have a normal cell, and the cell's job is, when you take in food, the food eventually breaks down to the cell, becomes glucose, and then it eventually goes into the mitochondria. That's the little mitochondria there. The mitochondria takes it and then makes more energy out of it using oxygen and nutrients, and produces about 36 to 38 units of ATP, right? So that's the normal cell, what happens there. And in the meantime, it produces metabolic waste, which then you excrete either through your breath, through your pee or your poop, right? That's a normal functioning cell. The cancerous cell, on the other hand, something happens where the normal pathway of food's coming in and then trying to be turned into energy in the mitochondria, but the mitochondria doesn't work properly, and it's usually because of some type of toxic assault to the mitochondria. And then the mitochondria then signals the DNA in the nucleus to become cancerous, what's called the oncogenes. The oncogenes are then activated, and it's producing lactic acid because it still needs energy. So it takes the food and it ferments that food, which ultimately turned into sugar, right? It ferments that and it produces lactic acid as a byproduct. And it still produces energy, but it's less. It's 4 units of energy instead of about 36 to 38. And then also it starts forming this fibrin coat, and the fibrin coat actually makes it invisible to the immune system. And that's what becomes the hard part about it, is the immune system can't see these cells. So it makes it really difficult for the immune system to keep track of this. Now, let's see how the body actually gets to this state, right? This is what we call the phases of homotoxicosis, and this was a theory of how the body degenerates and it was developed by this Dr. Recurrences, and he was a homeopathic doctor, which then looks at how toxins affect the cellular function. So first, when toxins come in, it goes through these 3 different phases. The body tries to excrete it, or there's a reaction, or then it's deposited. Now this is all the way outside of the tissues, outside the cell, in the tissues, okay? It's not within the cell yet. So if a toxin comes in, you either experience vomiting or diarrhea. If that doesn't work, then the body goes through inflammation, try to burn those toxins off. If that doesn't work, then it deposits it into the connective tissues. So it stores it away from the cell. Now, if you accumulate too many toxins, it crosses that barrier and it goes into the cell, which is called the impregnation phase. Now, when this happens, you start to interfere with cellular function. And over time, if you get too many toxins interfering with cellular function, then the cells start to degenerate. Okay? You get enough cells that degenerate and they don't work properly, then what happens is that the organ turns into a full-blown cancerous tissue. This is what we're saying that happens when toxins come in and damages the mitochondria. The mitochondria reacts. And it's within that phase of impregnation and degeneration that the mitochondria does not work properly anymore. And in the probably early 1930s, a Nobel Prize winner, Dr. Otto Warburg, he actually discovered what was causing these cancer cells to actually react improperly. And he was the one that basically said, it's really not the DNA, it's really the mitochondria. And what's happening is that even in the presence of oxygen, normal cells still choose to ferment, because fermentation takes place in the absence of oxygen. But even in the presence of oxygen, these cancerous cells are still in the process of fermentation, and there's lactic acid being produced. And the only reason why that would happen is because of damage to the DNA, and it happens because of toxins coming into the body, right? Now, if we look at the progression of cancer, which we call metastasis, we see that in the process of fermentation, the byproduct is lactic acid buildup. And what happens when the lactic acid goes into the extracellular matrix, it affects the other normal cells. It affects how they function. So those normal cells then, the oncogenes turn on and they become cancerous as well. But this research article basically showed that once you start changing the pH of the surrounding tissues or the surroundings extracellular matrix, and you take it from an acidic state into a more of an alkaline state, these metastases spontaneously inhibit. And this was a very profound study that was very much overlooked. And what it showed was that the pH of the extracellular fluid actually halts progression of this cancerous metastasis. So when I first saw this, I began to look at it and say, well, that's kind of interesting. Why are we looking at this more? Why are we utilizing these types of therapies to inhibit metastasis? And even this one, it says that it's a lot of jargon words. Matrix stiffening promotes tumor vascular phenotype. It's basically saying that when a cancerous cell starts forming, the surrounding extracellular matrix, so all the tissues outside of the cell, becomes more hardened and stiffened. And when the tissue surrounding the cell becomes stiff, it means that the toxins that are being produced by the cancerous cell can't get out and nutrients can't get in, right? And so one part of it, you got to look at it and say, well, if the stiffening of the matrix is promoting tumors to start forming, maybe we got to do something to the soft tissues, right? We got to increase circulation. Now let's look at the immune system's role in all of this. Okay, the immune system's job is to look at your entire internal environment and make sure that foreign pathogens aren't invading, and if there's something that's out of the ordinary, it takes care of it. So if the immune system, which is the police department and the SWAT team of your body, if that's going well and it's higher than the amount of the rate of cancer being produced, you're okay. But if it switches where the immune system is suppressed and the cancer is rising, you don't have much of a chance there. Right? This is the reason why cancer starts to proliferate, is the immune system can't keep up with it. And one of the big things that starts to degrade the immune system is chronic stress. And chronic stress produces chronic inflammation, and chronic inflammation produces all kinds of other things. High sugar intake, low amounts of nutrients, all this stuff suppresses the immune system. So let's take a step back. We know that there's lack of nutrients that will cause cancer. We know that the damage to the mitochondria due to toxins, homotoxicosis, will increase the amount of cancerous formation, and stuff like stress and lack of nutrients is going to decrease the immune system, so it can't take care of the cancer cells. So you kind of see this picture that there's more than just one thing that's causing cancer to start happening. Okay. But I'm sad to say that what we've been all told about cancer treatments is not the entire story. What we've been told is that there's 3 major routes that you can take once you've been diagnosed. You can either take the route of chemotherapy, radiation, or surgery. And most people, once they get diagnosed, they're like, okay, I'm going down one of these 3 routes. And the question I always get asked is, well, is all chemotherapy bad? And I'm like, no, it's not bad. I mean, there's certain times where it may be needed, it may be warranted. The goal of chemotherapy is basically it's to stop the rapid division of cancerous cells, because if the cancer cells are dividing rapidly, we got to stop that. If it's too advanced. But there's other things that you have to ask, and you have to make this decision as well. Is you got to look at it that chemotherapy is working 100% of the time. It does its job flawlessly. However, it's non-selective, meaning that it doesn't just attack the cancer cells. It attacks the healthy ones as well. But it never addresses the causative factors. Okay? So here was a study that was released in the Clinical Journal of Oncology, and they looked at the 5-year survivor rate of chemotherapy patients. And what they found was that a 5-year survivor in adults was estimated to be 2.3% in Australia and 2.1%, basically less than 2% made it. Okay, and so basically you're looking at a 97, 98% failure rate of these treatments. That's basically one of the three common things that's being proposed to any type of patient undergoing cancer. To me, I look at that and I'm like, okay, that doesn't make sense. And some people look at this and say, well, it worked for some people. And, from a clinical standpoint, I don't know many people that have had advanced cases of cancer that have actually gone beyond that 5-year mark. I've seen too many people get degraded and get too many recurrences. And you look at that, 2.1% to 2.3%. That's a 97, 98% failure rate. So you have to ask yourself, why so low of a success rate? Well, let's look at the chemotherapy mechanism. Well, one mechanism is that it blocks hormone receptors if it's, hormonally, or the theory is that it's hormonally induced. And then the other part is that it stops the cell from dividing by interfering with DNA replication. But remember, the findings was that the mitochondria was the one that was damaged, which then signals the DNA within the cell. Because remember, they switched out the DNA in the nucleus of the cancerous cell and the healthy cell, and that didn't affect it. Oh, I forgot to tell you one thing about that study. When they switched the cytoplasm, or the mitochondria area, when they switched that, the normal cells did become cancerous. So then they did make a confirmation with Dr. Otto Warburg's findings of fermentation in the presence of oxygen, and also with that study. So if we're looking at it and all roads point to the mitochondria, and we're not addressing the mitochondria, there's no wonder why there's such a low success rate with chemotherapy. And there was an MD, he wrote a book, and in his book he said most cancer patients in this country die of chemotherapy, not necessarily from the cancer itself, but because of the treatment. It says chemotherapy does not eliminate breast, colon, or lung cancers. This fact has been documented for over a decade, yet doctors still use chemotherapy for these tumors. I often question the use of that as well. And there was a study that was released out in the Journal of Nature Medicine in 2011, and it showed that treatment-induced damage to tumor microenvironment promotes prostate cancer therapy resistance through the blah, blah, blah. Jargon basically said that the use of chemotherapy actually caused the proliferation and the progression of the disease. It promoted the cancer cells to survive more and to spread more. And this was a published study, and there's a link. You guys can go ahead and look at it and read it. So the thing that you guys have to think about and question is, you need to address the causative factors as well if you're going to go down that route. Okay, but you got to look at this. This is a current standard of care in the medical profession, and this I shake my head at all the time. This is what's being recommended by oncologists today to their patients. They recommend them eating a diet of like hamburger, French fries, milkshakes, a lot of sugary foods, all because they want them to gain weight. And if you look at it, cancer cells have 20 to 30 times more sugar receptors on its surface, and it feeds off of that. It needs the sugar to ferment, and the fermentation creates more lactic acid. So if we create more sugar by feeding it more sugar, what's going to happen? Of course it's going to spread. We need to be focusing on the causative factors. We can't be giving these people the fuel. We can't be throwing gasoline on the fire. Here's another one that I found on a blog where a registered dietitian is talking about what she recommends as a diet, and I underline these things. She says, think kid-friendly foods, which are often high-calorie dense items in a small package. Look at that. She's promoting eating ice cream with bananas, chocolate syrup, caramel with sprinkles, milkshakes, and I'm sitting here scratching my head. I'm saying this is what's being promoted to people undergoing chemotherapy and undergoing cancer, when sugar is one of the main reasons why cancer cells are proliferating. I scratch my head to that. And I look at it and I say, well, that can't be true. So I had a patient that came in that was undergoing chemotherapy. It wasn't working for her, and she said while undergoing chemotherapy, one of the things that they would do after they were done with their sessions was they would be offered sugar cookies to get their blood sugar up. And I began to scratch my head. And if you look at her numbers all kept increasing even with the chemotherapy. So I began to scratch my head even more. We're not winning this war, guys. It's kind of like we're losing the war even more by friendly fire. So now we got to ask the question, well, if we see that cancer goes away, we go into remission, well, then why do recurrences occur? Well, it's like this guy here. You see this guy, you say you got your lawn full of weeds, and this guy comes along, and all he does is he takes care of the weeds. He never gets to the roots, and he never gets to the seeds. And all he does is chops it all off, spreads the seeds everywhere. Of course, you're gonna get the recurrences, because if you give the seeds the right environment, it's going to proliferate. You water it, you give it the right nutrients, you turn around, your yard is going to be full with weeds because you never addressed the causative factors. You never eliminated the things that would spread that stuff. So that's why recurrences occur, and it happens to so many people. I see so many patients go through this kind of stuff, and most of the patients that come to my office, it's usually because of the recurrences. The majority of the patients that come to our office is because they had recurrences and they want some type of other route. They saw that the first route that they took didn't get them to where they want to be. And they know, well, maybe I should have looked at the causative factors. So they want a holistic treatment process, and this is what we do. Again, we're not focusing on curing it, because cancer is nothing to cure. The body is responding to a toxic environment. Just like if I put you in a room that was really hot, your body would respond to it by perspiring and creating sweat. That's not a disease. It's a response to the environmental factors. So if we know that there's environmental factors like toxicity that's damaging the mitochondria, which is causing it to switch its genes on to get into survival mode, then we got to be focusing on improving health and the health status of the cells. And then the body will do what it needs to do. We're not here to cure cancer, and that's actually a false statement. You can't ever cure it, because it's like saying I'm going to cure perspiration. No, the body's always going to perspire if put in that environment. So this is what we got to focus on. We got to focus on changing that environment, and we're doing that through diet, lifestyle, supplementation, and stress reduction. Simple. And this is the protocol we use in our office. Is we remove, we repair, and restore. We're removing the toxins using infrared saunas, juicing, ionic foot baths, coffee enemas, all the things that we can do to get the toxins out of the body as fast as possible. And then we got to repair the cells. We use that through pulse electromagnetic field therapy, which helps boost cellular function. And there's thousands of studies that's done on that, and you can look it up online, the efficacy of pulse electromagnetic field therapy. There was even a TED talk that was done by an oncologist using PEMF. So it's called PEMF. They were using it to help with glioblastomas, which is brain tumors. And he did a TED talk and showing that how he used PEMF to actually help reverse that. Radiofrequency EMFs, nutrition, homeopathy, lymphatic drainages, because remember, the main focus is changing the environment, and the environment is what? It's full of toxins. The environment is acidic. We gotta change those things, and then the cell will respond to the change. And then we gotta restore. We gotta restore how the mind and the body interact with each other, and then creating neurological balance, because the body is going into a survival mode and it's not thriving anymore. So this is basically what we do in our office. And the healing process is like this. In the first phase, the removal phase takes about 6 to 9 months. This is where we're just focusing on detoxification. Then another 6, maybe 7 months to repair the body. This is all depending upon how much damage has been done to your body. And then the last 6 months is, and for the rest of your life, is restoring and maintaining, is making sure that we keep that environment well and healthy. That's the healing process. So this is what I tell all my patients. Your commitment to health, when you come into the office, you got to be able to commit to at least coming in twice a week. This is minimum. And Again, this is according to where your level of health is at. You got to commit to at least being in it 2 times a week. And then, some may need more intensive care. And during this time, our focus is on removing, repairing, and restoring. Remove, repair, restore. Remove, repair, restore. And that's what we're going to do the entire time. And then at home, you're going to be focusing on detoxification, changing your diet, changing your lifestyle. And also, this is a big one, guys, having family support. This is one of the big things where I see people go wrong in their treatment program, is that their family's not on board, and their family often tries to dictate their care. And their families are always saying, well, you should do this, you should do that. And ultimately, it's your body. You have to live with it. While family and friends may be meaning well, they don't necessarily know the entire story. They've only known what they've been marketed to. Okay? Do your research and use critical thinking, guys. Okay? So here are the rules I have in my office for healing. If you're going to start on a program like what we do in our office, you got to focus on that. Don't dabble. Don't say, well, I'm going to do this and that. Just focus on one. And the reason why is that your body becomes confused if you're doing too many different things. You just want to focus on one thing. If you're going to do something else, do that and focus and commit to that, right? Always have a positive outlook and mindset on this. Don't look at cancer as a disease. Remember, it's not a disease. It's an adaptation. And if you focus on that, if you focus on that it's a disease and, oh my gosh, I have to fight against it, I'm going to win this war against cancer, you only stress your body out, because it's the same idea of saying you're going to win the war against perspiration. It's the mindset of knowing the truth and really focusing on what you need to do. Okay, so focus on healing. Don't focus on curing the cancer. And then you got to keep your appointments. This is very important. It's this consistency. It's kind of like going to the gym. If you want to get more muscle mass, you want to get healthier, you got to keep consistent with it. You got to commit to your nutrition. Don't waver off of it. Even though you may have the cravings or whatever, you got to commit to your nutrition. You got to commit to your lifestyle. And then also commit to your health education. Learn how the body works. And that's one of the big things that I do in our office, is I want to educate our patients on how the body actually works. So let me give you a few stories. Some patients may actually be on this, and I wanted to share their stories. This was one fun story. This is Min, and he brought in his mom, and she wasn't given much hope. She went the route of chemotherapy and all that stuff, wasn't getting much results. She had a very difficult time walking and doing all that kind of stuff, just from the lack of energy. And then, he wrote this post that, that he came downstairs and he saw that his mom was really, doing stuff and just having a normal lifestyle again. And it kind of brought warm fuzzies to him, and just to see her doing those things again. When I saw him post that, it really brought a smile to my eye, just seeing her get her lifestyle back. Sarah was another one. She went and got rescanned after a few weeks, or maybe a month or so after, being treated in the office. And, we saw that, nothing progressed, nothing stopped, it didn't go away, but it hasn't progressed. It's just staying where it's at, knowing that, hey, you know what, we're on the right track. We're not poisoning her, but we're doing the things to halt the progression and do maybe some type of reversal. Because what are we doing? We're not curing the cancer, guys. We're giving the body what it needs, and the body will then respond according to the environment. I mean, you can look it up anywhere. It's physiological that the cells respond to the environment that they're in. This is another one. This is a really cool story. This is another patient where he was put on hospice. He came into the office. He had a very difficult time walking when he came into the office. Looked very sick, as he should be, going through all of those treatments. He was only given about 3 months to live. He had stage 4 lung cancer, and worked with him for a little over a year, and we were able to celebrate his 82nd birthday, the ending of this past year in 2016. And I just saw him recently, a couple weeks ago. Looks great, and he's still going strong. And the cool thing about it was he went back, got his PET scan. I'm not going to share his results directly on here, but His doctors basically gave him a clean bill of health. And it's awesome to be able to witness these things and just witness how the body can heal itself if we give it the right things in the right environment. So what are your next steps? So your next steps would be to make a decision. Everything starts with a decision, and I always tell my patients, you have to ask yourself this one question: how much do I value my health? When we lost my grandmother at age 61, I sat there in my dorm room in college, sitting on the floor, crying, and saying, and just really saying, I would give anything to have my grandmother back. And so, your health is priceless, and that's the way I look at all of this, and that's why I'm so passionate about what we're doing, in our office to help patients. Like I said, we're not here to cure anything, but we're here to improve the health status of your body. So you first is make a decision of what do you want to do? Where do you want to take your health back? And then go to our website, www.velocitywellness.com/intake, and fill that out. And what will happen is you'll fill that out, and it'll come to our office. We'll look at it, and then what we'll do is we'll see if you qualify for treatment in our office. And there's criteria that we look for in our office. We look for people that want to get well. We look for people that will actually be committed to the treatment process and the things that we tell them to. And once we deem that you qualify for care, we'll set up an appointment. And then in the appointment, we're going to go over the treatment costs. We're going to go over the treatment options, because there's different things according to what's going on in your body. So it'll be determined by that. And what we do recommend is that all of the decision-making parties, like say you have a spouse or maybe son, daughter, aunts, uncles, all the people that's involved in the decision-making process, we require them to be in attendance when meeting with any of our staff when going over the treatment process. That's just to make sure, and the only reason why we do this is to streamline the process, because time is of the essence. The sooner that we can get you started enrolling, the better. We don't want you coming in, going through the information, going home, waiting for a decision, because every day that goes by is just time that we don't get back. And when time is of the essence, because we got to get the body starting on the rolling of detoxification. Okay, and then the next thing is, once you've made that decision to get started and take that step forward into getting your health back, you got to take obsessive action. You got to be obsessed about your health. You got to be obsessed about your program, and you got to switch the mindset. We're not fighting cancer. We're not curing cancer. We are getting your health back and getting your foot in the right direction to become healthy. So I hope this was informative. I hope this was helpful. Like I said, if you have questions, again, go back to our website, www.velocitywellness.com/intake. Fill that out. Tell us everything. And then we'll see if you qualify for treatment in our office and qualify for a consultation. And then we can kind of go from there. So again, this is Dr. Mike Okuchi from Velocity Wellness Center in Irvine, California. Signing off until we meet again. Aloha.